welcome Rani and everyone who might be watching this video to my first heart-to-heart conversation podcast. And I'm starting this podcast this year because I'd like to encourage really heart-to-heart conversations about subjects that might not be so easy to talk about every day, that might be a little bit embarrassing or associated with shame or taboo or misunderstanding or misconception. And I'm kind of starting this podcast to connect, to share information, so that hopefully all of us feel a bit less alone with whatever we are exploring and talking about together. So today, my very special guest is Vani, Dr. Rani Bora. And Vani and I feel we have quite a special connection in a couple of ways. We both have a very strong mental health background. Rani, you've been working as a consultant psychiatrist in the NHS for 10 years or over 10 years?
More than 10 years, yeah.
More than 10 years? How many years have you worked in the NHS?
20 years, yeah.
Oh, for 20 years as well. For 20 years as well. Yes, me too. I've worked in the NHS for 20 years and I left a few years ago. And I think you're still working in part-time.
I did live a little bit and then I came back, but I'm only doing like very part-time locum work. So I'm not like substantive, but I have worked in NHS for a very long time.
Right, yes. So that's almost like I feel I've had a long-term relationship with the NHS. And when I left it, it was like ending a long-term relationship.
You go through like bereavement and loss.
Yes, and the uncertainty. And then I discovered a whole new world outside the NHS. And in this world, I met you. So we also are currently classmates in Ankush Jain's amazing coaching career school. And so we both also share a passion for, I think, facilitating growth, transformation in ourselves and others. Is that fair to say?
Absolutely. Oh, Kirstine, I mean, congratulations. This is your, like you said, this is your first one where you're inviting for heart-to-heart conversations. And this is so needed, isn't it? Like where people can just be and not feel worried about being judged and really have those conversations, like you say, where we can be ourselves and we can really look at what does transformation look to us, and how can we also invite people for to look within. So yeah, I completely agree with you. I think we haven't known each other for long, but like when we met, it was like best friends. And we also loved, didn't we, that you're a psychologist and I'm a psychiatrist, like by profession, and most people will know that they are not necessarily the best of friends in terms of like
that's right. In the NHS, there can be lots of rivalry and competition between those two professional groups, psychologists and psychiatrists. And
not every time, but majority. And
it can be the case. I've had really good working relationships with some psychiatrists and really difficult ones with others.
Yeah.
And so I'm especially delighted that we get on so well and have so many things to share. And today we want to talk about the subject of what is called de-prescribing, which is helping patients to come off psychiatric medication. And I think that's such an important theme in mental health as well, isn't it? And I just wondered what led you to develop a special interest in that.
Oh, thank you, Christine. It's really interesting. When as part of my training, I was never taught to learn how to de-prescribe a medication, because part of how I see my role was I'm a doctor, I have a prescription pad, I assess someone, I diagnose someone, and then when it comes to treatment, if the person needs psychological therapy, signpost to the psychologist. Okay, the person needs medication, so there I am with my prescription pad writing medication. If they come back and say it's working a little bit, but it's not working as much, I'll keep increasing the medication, or I'll be adding medication. So that has become ingrained in us. Like, okay, someone is fulfills a criteria of a mental health condition, and the evidence base says biopsychosocial. So biological, we give medication, and then we also look at psychosocial aspects. And people will say all of them are important, but when you see a psychiatrist, I guess there's an expectation that at the end, if the doctor has diagnosed you with a condition, they will also prescribe you medication. So
Mm-hmm.
that comes naturally. The best analogy I can give you is this, and I heard this and I thought, wow, that really sums it up. So someone said, and this is a well-known colleague of mine, he's a psychiatrist. He said, we have been taught how to drive the car, but we know how to drive the car forwards. Okay, so prescribing is like we know how to prescribe and then we keep going forwards. We haven't been taught how to reverse the car successfully.
I love that
Yeah, so
analogy.
yeah, beautiful, isn't
Yes,
it?
yes.
In a way, de-prescribing is about reversing the car. And so if you're
Right,
not
right.
careful and and you have not been trained to do it, you could have a crash and that kind of thing.
Yes,
And I thought, yeah, how interesting is this, isn't it?
yeah,
Because
yeah.
everyone can do prescribing, but how many prescribers and how many doctors really understand the prescribing the right way? Because I have seen cases where they've just been asked to half it or just stop it after
Right, right,
years and
right.
years of use.
So how would you give, if I ask you, or if a client asks you, Dr. Rani, what actually is de-prescribing? How would you just briefly and simply put that?
Okay. In very simple words, as to what makes sense to me right now to say,
Hmm.
if someone says on medication and they want to come off it, then it's called deprescribing. So,
Uh-huh.
we are looking at gradually reducing and stopping the medication.
Right,
So basically, that's what deprescribing is, or some
right,
people might call it tapering. They might call it
right. Yes.
deprescribing because deprescribing is more of a jargon, medical jargon, isn't it? Because
Hmm.
people might say, a doctor might say, I'm deprescribing, but
Right.
a patient won't say, I'm being deprescribed. They'll say, I'm tapering my
I'm
medication.
coming off medication,
I'm
or
coming off
yes. Oh,
medication.
okay. Yeah. Right. And and is that a bit of a controversial process? Because to come off medication, or it's certainly, there are so many mixed feelings about it, aren't there? Because there are many benefits of coming off medication, and there are also side effects. And I think many clients have
Withdrawal
uh,
effect, withdrawal symptoms.
withdrawal symptoms and are scared of these symptoms and therefore stay on a medication. So what are the benefits of tapering or coming off medication, and what are the risks,
Okay.
Ronnie?
I think that's a great question, isn't it? Because how do you know that it's okay to come off medication?
Mm,
For some people, I think the reason why they want to come off medication is they say that, look, it helped me at some point, and I think my life has improved. Now my life is going well. I don't see the point of taking this medication anymore.
mm,
So I want
mm,
to come off it. So that's
mm.
one scenario. Another scenario could be that I'm having a lot of side effects from this medication. So I want to come off it. Even if it helps at some point, this antidepressant, but I think I'm feeling numb and I have all these problems. I can't sleep and I would like to help come off it because I'm also doing some other things to help myself. Or the third thing would be that people say, I have been on these medications for a long, long time. I don't even think it's doing anything because I'm
Yes,
still
yes,
feeling quite rubbish in myself. So I want to come off
right,
I want to
yes,
come off this. So this could be all kinds of things, or people could be a combination of medication. They could be on, we call it polypharmacy. They could have,
okay.
over the years, they might have had lots and lots of medication. They are saying, look, I can understand why I'm taking this one, but I'm not sure I need to take all five or all three,
Yes, yes, yes,
and I come off this one. So those
yes,
could be the reasons why people might want to taper off medication.
right, yes. Yes, one of my clients, for example, who has been on an antidepressants for some years, he doesn't quite know whether it's working or not working. Because when he started them, he was in a very turbulent phase of his life. He went through a painful breakup and felt quite destabilized. And now he's been in therapy with me for some years, individual and group, and he's doing well. He's stabilized. He's certainly not unstable. So he's wondering, is it a good idea of coming off, but he doesn't want to be destabilized? But does it actually do anything? And do the effects, the stabilization? I think one of the problems is sometimes clients who are on medication and they make actually changes in their lives don't know why they're feeling better, whether it's the medication or whether it's the therapeutic work. And that's one of the sort of why I fear sometimes people don't fully own the work they've done psychologically, because they think, well, it's the medication in a way. There is almost like a confusion about ownership of change, and yeah, so that's an interesting one as well.
I absolutely love what you just said because there's something called a placebo effect.
Uh-huh.
Yeah. So, in terms of especially antidepressants, there has been lots of studies comparing antidepressants along with placebos. Placebos means like it's a sugar pill,
Yeah.
and they don't even have the side effects. And so there is a lot of evidence that at least in mild and moderate cases, placebos are as good as antidepressants. So when you say that someone
Yes.
has been taking medication and then they are also doing all these other things, and they didn't have severe depression to start off with, but they were struggling with experiences of low mood and and then they got
Anxiety, yes.
of mild to moderate depression. How do you know what is doing what? Yeah,
Yes.
especially if the trials have already shown the placebo could be as good as antidepressants. How do you know is all your benefit is coming from the taking the antidepressants and
Mm,
nothing is
mm.
coming from all the other stuff you're doing, including
Yes. Yes.
therapy, including connecting with your loved ones, sleeping well, having a good diet, exercising, connecting to nature. Because there is a lot of like overlap, isn't it? Like good stuff are happening this way and that way. But
Yes.
people might say, well, it's the antidepressants, it's the antidepressants.
That's right. Yes.
Yeah. And
Because
can
a
I say
doctor
something
has
else?
prescribed them. Yeah, I
Yeah.
feel sometimes when a doctor prescribes something, it almost has a bit more weight to the intervention, in a
Yeah.
way.
Yeah. Yeah. I remember something else to add. Sorry.
Yes.
Um, Sometimes people come to me and they say, "Oh, I'm feeling low, or I'm feeling anxious. I need an antidepressant." And I would say, look, even the guidelines say that before we try, unless you have got severe depression, before you try medication, you need to try other self-help strategies. And lifestyle medicine is really is evidence-based medicine, which is not about prescribing a pill, but is looking at the six pillars of a lifestyle, like I said, mindful activities and exercise and sleep and diet and connection with others, and also reducing intake of addictive substances. So anyway, so I have
Right.
so many cases where people
Yeah.
say, I want an antidepressant, or I'm not feeling well, and I would give a lifestyle medicine prescription, and I say,
Right.
come back after doing all this for a month or
Mm,
so, and then we'll see
mm.
how you get on. And
I
then
love that.
not everyone, but some people say, "Oh, hey, I'm really feeling better." And I said to them, "Look, if you had done all those and also had taken an antidepressant at the same time, what would you have contributed to the benefits to?" And they would pause and they would say, "Actually, I think I would have attributed all this to the antidepressant." I said, "There you are. This is
That's
proof that,
interesting, Ronnie.
yeah,
Yes.
without the
Yeah.
antidepressant, you have been able to do this and
You,
shift."
yes. Yes. But they would have attributed it towards
Yeah.
to the antidepressants. Yes. Can you repeat the six pillars of
Yeah.
lifestyle medicine? I thought that's really interesting what you said.
Yes, so the four are very, very easy to remember. I just call it, the acronym is MEDS, interestingly. I
Okay.
say, I
That is
say,
interesting.
yeah, I say old meds not working. Try this new meds, okay?
Yes.
It's just a chicken tongue. So M stands for mindful activities.
Mm,
E is for exercise or movement. Even if someone can't do exercise, we can do movement, right? Because we are
okay.
so, sedentary habits really affect
Yes.
our mental
Yes.
state.
Yes.
D is for diet. Obviously, we all know the impact of nutrition and the food we eat on our mental health. And S is for sleep and
Uh,
how important for us to actually prioritize our sleep. Those are four pillars of lifestyle medicine. The fifth pillar is the connection with loved ones, connection with just our community.
yes.
And I would also add connection with nature, connection with our true self, going
Lovely.
inwards,
Yes.
that kind of
Yes.
connection, I would say.
Yes. Yes.
And the final one is abstinence of addictive substances like
Okay.
drugs, alcohol,
Yeah.
smoking, or at least reducing
Yes.
those
Yeah.
substances that we know that are not very good for our
Mm,
mental health.
mm, mm. I love those. They all are so very important, aren't they? Yeah,
Yeah.
the quality of our relationships, what we eat, our mental diet, our nutritional diet, all of it. Yes.
Mm.
So here's another question for you, Rani. So thinking about my client who is quite happy staying on the medication because he's a bit worried of rocking the boat. Yeah. What are there any uh, possible harmful side effects of staying on medication? Let's say on an antidepressants, let's say venlafaxine. Is there a harmful potential of staying on medication for many years, even if it's not clear whether it's still needed or not?
Mm. I think what I would say is that there's no long-term study to say how beneficial it is, but in terms of real life experiences of people, my understanding is that, and I will talk from my clinical experience,
Yes.
is that I have seen that the longer people have been on the medication, one is they develop tolerance to the medication. So
Mhm.
initially, even though they might have done something, like you said to a client, that initially they might have, helped them when they were going through a very turbulent time. But
Yes.
over time, they lose their efficacy. So
Right.
in order, like in other words, we develop tolerance to it, so it won't be having the same impact. And for example, say they were doing fine and they were just on the medication, and a trigger happens, something happens, a life event happens, and they might find that the medication is still not helping them and they need a higher dose or need to add something else. So in terms of long-term effects, I have seen a lot of side effects long term. That's people might not even contribute to the medication. Numbing is
Right.
a very, very common one. So people can't understand why they are not like able to experience joy or like in the emotions. They don't see why like they have like they are okay, but they don't feel like themselves. They just feel a numbing. Emotional numbing is a very, very common one. And even
Yes.
long term, you
Yes.
see that.
Is it like an emotional numbness or a feeling unalive in a way? That kind of
Yeah, I think
feeling.
that's a very, I
Yeah.
think that's a very beautiful way of expressing it. Just people
Right. Yes.
feel somehow something's missing, that's not connected. They're
Yes.
a bit duller in their like senses.
Yes.
Cognitive impairment is a very important one to consider because most people say they find that they are not having the same concentration for some reason, so they can't concentrate.
Interesting.
Yeah,
Mm.
that's one. Sedation, not feeling a bit sluggish or not having feeling exhausted or feeling tired for no reason. Again, those
Right.
could be very common ones that people might not attribute necessarily to side effects, but I
Yes.
have seen it so many times people have this.
That's interesting because again, it could be so easily misattributed to having a new job, having a new role, or but it actually is almost subtly the medication that could be at work in
Yeah,
a
I won't say
yes,
it's all the
yeah,
medication because sometimes people might not have it, but I have
yes,
seen what people you might even describe as chronic dysthymia,
yeah,
because depression is supposed to be
right,
episodic, and we knew that how when we studied when we first studied about how you find depression. Depression was supposed to be episodic, like you have an episode of depression, you get treatment, you get better. Again, then after getting better, again you might have another episode, and then you get better. What we
yes,
are seeing more and more now, at least I am seeing that in my practice, is it's less episodic and more like chronic.
chronic, yes,
And then you wonder, like, why is it becoming so chronic, especially if the medications are really supposed to be helping you? So
yes,
I'm saying that, please, anyone watching this, please don't see that as a sign that you need to come off your medication. Absolutely not. There's so many things to explore. Like you said, what could be the downsides? And one of the downsides certainly is that if you have been on medication for a long time,
mm,
coming off the medication necessarily might not be a good idea, and especially
right,
if you don't have the proper help. If you
okay,
try to come off it by yourself, with very little support from your GP or from your psychiatrist or any doctor, and you have been on it say for 20 years, I
right,
think it is not going to be easy. You might,
right,
and if you don't have any side effects, again, and you have tried it, and you might have tried coming off it, and
mm,
and you tried you tried liquid preparation, or you tried to do it very, very gently with the help of the doctor, and you couldn't do it. It's just as a sign that like you need to think about, well, what can I do? Because although trying is good, you really need to have good support. And if you don't have good support, I don't know. The true answer is I don't know. But it's about the person thinking what is right for me right now.
Yes, it's a very individual decision.
Yeah,
Yes.
yeah, they need to be, they need to have a consideration of it. I think, one of my let me say a bit of frustration is that we need to have these conversations when we pick up the prescription, before we pick up the prescription and start writing an antidepressant. These are the
Yes.
conversations we need to have with people, like, and it's called informed consent. Like, we are giving in all the information people need
Mm.
in order to make a decision that, look, starting is easy in a way, but when you want to
Yes.
come off it, it might not be so easy for everyone, okay? Because
Yes. Yes.
there's a big study some years ago said that at least like 50% people might have problem coming off. So for
Right.
50% or so, it might not be a problem. They might be able to come off it, but 50% for 50, for slightly more than 50%, it might be quite tricky. Why
Right.
don't we have those conversations at the beginning and tell people about that, and that the longer someone is on antidepressant, the harder it might be for them to come off it because of what we call the withdrawal symptoms.
Yes.
Also, the withdrawal symptoms might be more intense, or
Right. Right.
very severe in some cases.
Yes. Yes. What are these withdrawal symptoms? Is it called antidepressant withdrawal syndrome? That is like a term for that, isn't it? Yes. What are the symptoms of this syndrome?
Okay, so they can be both physical symptoms and mental
Mm-hmm.
health, symptoms. Physical symptoms like you talked about venlafaxine, and that is one of the notorious medications. Everyone recognizes that withdrawal symptom. Even if someone misses one day of venlafaxine,
Yes.
they can start feeling unwell. They can start having like what they call brain zaps. It's like my patients have described to me as like an electric shock, like they
Yes.
suddenly feel like there's an electric shock, and they're
Right.
so scared about that. And the moment they remember, oh, I forgot to take my dose, today's morning dose of venlafaxine, and they take it, then it goes away. So
Right.
so physical symptoms like
Right.
brain zap is very, very, very common. Um, Insomnia is another very common one when
Right.
people
Right.
have
Right.
those
Right.
symptoms. Like it just disturbs the sleep. They can't
Right.
sleep,
Right.
and there are so many others, but these two are, one of the main ones. Some people talk about um, aches and pains everywhere. Some people, yeah, flu-like symptoms. They think that they are having
Right.
flu. Actually, it is also the physical body really struggling with sudden abruption of, or sudden coming off the medication.
Yes.
So
Yes.
those are the physical symptoms. But the other interesting thing is that people also start getting
Right.
anxiety symptoms, panic attacks. Some people might also feel low, and then it can be misdiagnosed as a relapse of their mental health. And they
That's
might say, oh,
right.
you need to go back on the medication because you are having depression again, or you are having anxiety again. So very important to find out whether they're having any of those physical symptoms, which they
Mm.
never would have had anyway before. When they first had depression, they won't be having brain zaps. They won't be,
Right. Yes.
they might have insomnia, but there are quite a few of those, like tingling sensation or feeling like flu-like. Those are indicative that this might be withdrawal, because they try to come off it more quickly than their body can adapt to.
Okay. Mm-hmm.
So this is really important to know. Which, Christine, I really didn't know. Honestly, I didn't know any of this when I, for a long, long time. It's only been for the last how many years? 6, 7 years maybe, that I very accidentally came across this, and I said, crikey, people are harmed by the medication we prescribe, because there is
Gosh.
a community, they call
Yes.
themselves prescribed harm. And then many people in the community are quite upset, and you can understand why, because they feel
Yes.
wronged, and they feel that people should have told them all this, given them all this information before they even
Yes.
start medication.
Yes.
And then
How interesting.
I really felt for them, and I started looking at the research, and this is what I now realize, and now it's so clear to me. Like, once you see it, you can't
Mm.
unsee it. This is
Yes.
what's
Yes.
to me. I
Yes.
see it now.
Yes. Yes. So if some clients want to come off antidepressants, would the GP be able to help, or the community psychiatrists? Because you're saying you just came across this information not so long ago. Is that now part of a psychiatrist's training or GP's training, or is it still quite patchy? So what can clients sort of hope for when they go to the GP or to the community psychiatrist?
Yeah.
Can they hope for being guided and supported realistically? I mean, because GPs and psychiatrists and community are under a lot of pressure, and they might have to prioritize the time. So given all of this, sort of, what can a client expect from the kind of GP or community psychiatrist?
I would say the person needs to be their own best advocate.
Yes,
They
I
need to
love that.
come
Yes.
with the information, the proper information, and support and seek help, knowing the information first themselves, because they could like be very trustful of their doctors and say, I want to come off the medication, and the doctors, like you say, it could be very patchy. Many GPs now are aware, many psychiatrists are aware, but is it
Yes.
100%? I don't know. I don't think so.
Yes. Yes. Yes.
So,
Yes.
so it really depends on what information has landed on the table,
Yes.
whether they have chose to like look at it and review it and apply it in practice. Because I still know of people going to the doctors, to the GPs, and talking about the studies coming out and saying, "Look, I need to do it more gradually, or I need to go to the liquid form." And GP saying, "No, no, no, you can't. You don't need to do it." But the best thing that that patients and their loved ones, family members have access to now is that even the NICE guidelines for depression has been updated
Yes.
to say that withdrawal symptoms are can happen. Before, people used to think, oh, it only happens for up to 2 to 4 weeks. Now we know that there is something called protracted withdrawal symptoms. Like you can stop medication, say in January, and you might be fine for a couple of months, and then say like April time you start feeling unwell again. It doesn't necessarily mean that it's a relapse of your mental illness. It could be that it could be protracted withdrawal symptoms from
Right.
when you stop the medication. So you
So it's
need,
not an exactly a linear process. It can be a bit more complicated.
yeah, exactly,
Yes,
exactly. In
yes.
some cases, and so most people say, no, I can just give up. So you might be able to give up. You might be that 50% people who don't have any withdrawal symptoms, but you just need to be careful and make sure you know. But NICE guidelines have updated the guidance to say that, okay, we need to help people taper off medication gradually, if
Okay.
they want to, and if it is obviously if it is needed.
Yes, yes.
And it's safe. I think safe is most important when you say, what are the benefits, and and can people come off medication like after long-term use. We need to make sure they are safe, whatever
Yes,
they do. Like,
yes,
what is that, and
yes,
that I think is the underlying thing about all of this. And
yes.
we also have, and I think it'll be nice for you to put the link. We have a Royal College of Psychiatrists guidance about stopping antidepressants, and
Uh-huh.
it's on the internet. I think it will be. I'll send you the link so then you
That'd
can.
be lovely. I can put
Yeah,
it in the description under the video.
yeah, yeah,
Yes,
yeah, yeah. And then people can, what they can do, they need to read it at first and then print it out, take it to the doctor and say, look, this is what the, I'm not just saying this, or not anyone on the streets saying this. This is coming from the Royal College of
yeah.
Psychiatry.
So they're basically guidelines that help patients to guide them through the process.
Yeah,
And to
it's
kind
more
of
like a,
make informed choices.
yeah, I think informed choices. I think it's more like a small booklet or in a small guide
Right.
saying, this is the few steps you need to consider. And
Okay. Yeah.
so I think this is the best guidance out there at the moment that's accessible to anyone. And if you can print it off and you read it and print it off, and then discuss with your GP, I I would think the a GP who's really like open and wants
Yeah.
to have the
Yeah.
best for you, they are going to listen.
Yes. 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 That sounds brilliant. Because in a way, that's kind of pointing for people who are listening to our interview. I think what I'm getting from our sort of conversation today is, that going to the Royal College of Psychiatrists, downloading these guidelines is one thing, taking ownership of the process, and kind of almost collaborating with the GP if they're open. And then it's also about the other lifestyle choices in a way, strengthening their connections in life, relationships, what we eat, what we do, mental diet, all these different aspects. So it's a very holistic picture, isn't it, in a way,
Yeah, yeah,
that
and
will support someone to come off medication.
yeah,
Yeah.
and the one you mentioned, the last is the first step. The making those, I say that let's prepare the soil first. So people
Yes.
say, I want to stop medication. However, the sleep is like really disturbed, or
Right.
the lifestyle is one where it's not very, it's not great. They know that they have had better lifestyles. So it's about making that soil fertile first, like making
Yes.
sure that we
Yes.
are doing something about that first, because then you decide, okay, I feel like I am able to start this journey. And one of the things I always say to people is that wintertime is the worst time ever to make any changes to your medication.
Right.
And so if you're thinking of making any changes to medication, better do it like summertime, or
Right.
plan before summer, obviously, but there's no rush. This is like a slow process of really like turning, like we talked about, you tuning in, thinking, what do I really need at this moment? Is this serving me, or is like in a way, is it not serving me anymore?
Mm, mm,
If
mm,
we ask
mm.
those like self-inquiry questions, like, do I really need it for the rest of my life? Or
Yes.
when do I come to decision? You are not putting pressure on yourself to make any decision right now. You're slowing down. And
Mm.
when we slow down and make all the lifestyle changes first, then we are in a much, much better place to make this worthwhile experience and also
Mm.
have less withdrawal effects.
Yeah, that makes total sense. That's maybe a nice kind of place to begin to kind of slowly sort of wrap up our conversation for today. But I must say, I've really enjoyed speaking with you, Rani, and I've learned things that I didn't know before. And also, I'd like to say, if people are interested in asking you any questions, maybe you can give us your email address or your website address. And I'd also like to say, we do that in a minute, that we could easily do an episode two, part two of this conversation, because we've just we just explored the territory a little bit, and there's probably so much more to know and to learn about. So if people would like to sort of point their question towards Rani, feel welcome. Equally, put some questions in the comments, and I can pick them up, and we can do a part two of our conversation, which would be really good.
Yeah, yeah.
Right. Do you want to share like your website address so that people, if they have questions, can turn to you?
Yeah, yeah.
Yeah.
But before I do that, one final thing,
Yes.
please, 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 as a result of watching this interview, do not stop your medication. That's going to be quite harmful, I would say. Never stop medication abruptly. Never stop medication without consulting your doctors. This needs to be thought through, and I can't emphasize enough that I have seen a lot of harm because people saw an interview and said, oh, I don't need this medication, and stop.
Right.
I
Yes.
really
That's
want your
important.
yeah,
Yes.
your
Yes.
listeners to be reminded of that. And yes, my website is doctorsranisuraj.com, DRSRANISURAJ.com. But again,
Mhm.
Kirsten can put it under show notes so that you can have access to it.
Yes. And maybe just a last curious question, Ronnie. If someone wanted to specifically work on coming off medication, what what are the services that you offer in your private practice? Yeah, that might be quite of interest to some people as well.
I think thank you for that. I do de-prescribing. That's my special interest. I
Right,
do coaching and de-prescribing together as well.
right.
So there are opportunities to work with me. Anyone who's listening and thinking, I would like to start that journey. I think it's about time. But even if you don't want to, but you are quite keen to learn something else, or you want to explore working with me, I'm very happy to give a 45 minutes free consultation and we can have a chat. And it's not that you need to work with me. I would encourage you to follow up anything that makes sense to you after a conversation.
Mm, that sounds brilliant, Ronnie. Excellent. Is there anything else you'd like to say before we say goodbye for today? Anything else? Any thoughts, feelings, reflections?
I would just say that you are an amazing person. You're an amazing host. It's felt so gentle to have this conversation with you, and I know that anyone who's listening to this will feel your love, your how you are as a person. So this has been a beautiful experience for me. Thank
Oh,
you.
thank you so much, Vani. I hope we have more. I've also enjoyed our conversation. It's come very natural, isn't it?
Yes, yes.
And maybe there will be many more subjects we can explore together in this format. I'd love
I
it.
would
It's
love
really
to.
fun.
You are
Yes.
just, it's just fun to be around with you, hanging out with you, Christine.
The same as you, Rani. We do some more.
Yeah, we
Do some
will.
more heart-to-heart conversations.
Yeah.
Some with camera and some without.
Yeah.
So thank you so much. Goodbye, Rani, and goodbye everyone who's watching.